Obesity and diabetes rates are up across the country, including right here in Tennessee. For those who aren't finding success with traditional medications, some are turning to another option. Latrice Curry joins us now with more in Eye on Health. Latrice.
Well, Greg, a recent study on over 20,000 patients showed that 84% who underwent gastric bypass surgery experienced complete reversal of their type 2 diabetes. Now, we spoke with a local bariatric surgeon to get his reaction and find out more about who makes a good candidate for this procedure.
Numbers are on the rise when it comes to obesity and diabetes, with Tennessee near the top of the list.
We're calling this new epidemic the diabesity epidemic because it's a combination of diabetes and obesity all in once, growing together.
The first line of treatment for type 2 diabetes is weight loss, diet, and exercise. But when those methods of treatment don't work, some doctors are recommending surgery for their patients.
If a patient has type 2 diabetes and they're managing with a couple of medications, it's under good control, maybe they can continue to do that. What if they keep adding medications and they cannot control it? At that point, surgery may need to be considered.
Dr. Ponce says the longer you don't address the problem of diabetes, the more difficult it is to treat.
If a diabetic patient had surgery when it only been diabetic for 5 years, and it is obese, their diabetes resolution is close to 100%.
Dr. Ponce goes on to say if they've had diabetes for 10 or more years, the resolution drops to about 50%. Not everyone is a candidate for bariatric surgery. You have to have a body mass index or BMI of at least 40 and be at least 100 pounds overweight for men and at least 80 pounds overweight for women.
When you're overweight, you have more resistance to take care of all your body tissues when you have to deal with carbohydrates, and so there's not enough insulin to deal with all that.
And when it comes to weight loss surgery, Dr. Ponce says there is no quick fix. You still have to make a commitment to a healthy lifestyle change.
I think it's important for the people to know that surgery is not magic. It's not a magic solution. It's a tool, but it's a very effective tool.
And something to keep in mind when it comes to obesity and diabetes, if you have a BMI of over 40% or 40 or you're more than 100 pounds overweight, you have a 25% risk of developing type 2 diabetes. Now, on the other hand, if you maintain a normal weight, your chance drops to 5% for developing type 2 diabetes. As with anything, getting treatment early is key to getting and staying healthy. Cindy?